In this clip, we'll be discussing about the complications and management of alcohol dependence syndrome. So coming to I'll be only dealing with the psychiatric complications, not the medical complications. You'll usually be coming across patients with alcohol dependence syndrome as ALD, alcohol liver disease, cirrhosis of the liver, esophageal varices, that is what you'll come across. So you'll come across with GI complications, CNS complication, miscellaneous social. Please refer your textbook for that. I'll be only dealing with the psychiatric complication. The first complication is acute intoxication. So if you consume a high amount of alcohol suddenly, then you have the intoxication symptoms. So alcohol is a CNS depressant. Okay, so the person will be having slow thinking, poor attention, distractibility, ataxia. You must have seen people walking on the road after they consume alcohol. They don't have control, and disinhibited behavior. So taking off the clothes, using abusive language, beating up, getting into fight. Okay, those are the intoxication symptoms. The next complication is withdrawal syndrome. Withdrawal syndrome, we said, what is withdrawal syndrome? It is like when a person is consuming a large amount of alcohol for many days and then suddenly they reduce or they stop consuming alcohol, then they'll have the withdrawal syndrome. Withdrawal syndrome, we have delirium tremens, alcohol seizures or REM fits, and we have the alcohol hallucinosis. First one, delirium tremens. Delirium tremens or DT, capital D, capital T. So DT is a very severe type of withdrawal syndrome where a person, after complete stopping or reduction in the amount of alcohol, 2 to 4 days after this, the person develops this complication called as DT. You must have seen some patients when they come with fever or some fracture accident or some emergency surgery. Now suddenly they have stopped consuming alcohol for a couple of days. So these patients will they'll be very confused, disoriented, and they'll be like, they'll try to crawl up the wall, and they'll have they'll not sleep properly, they'll become confused, lot of disruptive behavior and all this you'll be basically seeing. So that is delirium tremens. So what are the symptoms of delirium tremens? One is they have clouding of consciousness, and they're disoriented to time and place. They don't know where they are, what part of the day it is, and poor attention and concentration. The third symptom is illusions and hallucination. They have very frightening visual hallucinations, and they have a lot of illusions they tend to have, which is frightening. And the autonomic disturbance like tachycardia, increased BP, fever. They tend to have pupillary dilatation. Then they have psychomotor agitation, insomnia, reversal of sleep wake. So they will be awake in the night and they'll be drowsy in the daytime. So these are the symptoms you'll be seeing in delirium tremens 2 to 4 days after completely stopping alcohol, and if not treated, it can even lead to death. So this is a severe complication. Management, we'll discuss about it later. The second withdrawal syndrome is alcohol seizures or REM fits. Patient will have generalized clonic tonic seizures after 12 to 48 hours after heavy drinking. The person will have these REM fits. It can be, they can have continuously, they can have 4 or more seizures, and they can go into status epilepticus. The third complication is alcohol hallucinosis, where when the patient was consuming alcohol, now in very clear consciousness, not under the influence of alcohol, he has auditory hallucination. He hears voice. It is called hallucinosis because there is insight. Okay, and so the person starts hearing. It's a withdrawal symptom. Starts hearing voice. With few months to 6 months, this will resolve. Okay, so these are the 3 withdrawal symptoms: delirium tremens, alcohol seizures, and alcohol hallucinosis. The next complication is the set of neuropsychiatric complication. I'll be only explaining Wernicke's encephalopathy and Korsakoff psychosis. Wernicke's encephalopathy is because of severe deficiency of thiamine. Now, thiamine, vitamin B1, is needed for your carbohydrate metabolism. You must have studied in C3 cycle in biochemistry. So, in the absence of thiamine, if the person has carbohydrate metabolism, it leads to permanent brain damage, mainly in the form of some neurological ocular signs, and higher mental function is uh, affected. In the higher mental function, there is disorientation, confusion, memory disturbance, poor attention, distractibility. All this is very common. Usually it starts off after repeated vomiting, so persistent vomiting. After that, person will be disoriented, confused, memory loss. All this the person will be coming with. The next one is Korsakoff psychosis. It is called as Wernicke-Korsakoff's psychosis. So Korsakoff psychosis is also called as amnestic syndrome. Mainly, there is recent memory is affected. The person does not remember what happened few hours ago, what they had for breakfast, they not remember, and there's confabulation. They try to fill up their deficit of the memory with their own explanation. They've had breakfast as idli, they'll say I had puri, or I did not have breakfast. They cover up their memory. And there's a lot of other neurologic damage to the brain which happens because of that. These symptoms develop. Okay, so these are the main complications of alcohol dependence. Apart from medical, we have intoxication, withdrawal syndrome, which includes delirium tremens, rum fits or alcohol seizures, and alcohol hallucinosis, neuropsychiatric complication, Korsakoff's psychosis and Korsakoff psychosis, and Wernicke's encephalopathy. Okay, so now coming to the treatment. Okay, so treatment, it is divided into two. One is detoxification and de-addiction, or treatment of dependence. Detoxification takes place in the first 2 weeks after the person stops consuming alcohol and he comes for treatment. So this that is what is detoxification: removing the toxin, that is the effect of alcohol from the body. So mainly the medicine given here is benzodiazepine, so chlordiazepoxide, Librium. You must have come across Librium, a small yellow tablet. Librium is given 80 to 200 mg, and diazepam 40 to 80 mg, lorazepam. These are the tablets which is usually given in divided dose, depending on how often the person used to consume alcohol, 4 times a day, 3 times a day. It is gradually tapered, gradually reduced and stopped over a period of 2 weeks, so they will not have these withdrawal symptoms. Along with it, thiamine 100 mg is given every day, and then it is replaced by B complex tablet. So you must be seeing these patients getting that yellow liquid, Optineuron, any multivitamin which in IV fluid, we give it. So IV fluid which has thiamine 100 mg has to be, multivitamin which has 100 mg thiamine has to be administered to the patient. Fluid replacement also is taken care of. So mainly the complication of withdrawal symptom is what is handled during the first 2 weeks. Next, after the 2 weeks is your treatment of alcohol dependence or de-addiction. So here starts off with behavior therapy. Okay, behavior therapy mainly assertiveness training, self-control, relaxation technique, positive reinforcement. All this is basically taught because these people cannot say no. They can't say no to their friends when they are called, come let's have some alcohol, somebody calls them, or they do not have any control once they start consuming alcohol. So behavior therapy is useful. Earlier aversion therapy was used, now not so much. Psychotherapy, of course, you have to give a lot of information about what is alcohol. It is a disease, it has a genetic load, so individual and family group has to be made aware of alcohol and its ill effects. The third treatment is group therapy. Very effective is our Alcohol Anonymous, AA. So it's a self-help group. So people who have overcome alcohol, they come and explain to the patients, and there is a discussion, and they tend to overcome alcohol through this group. Alcohol Anonymous is a very common group therapy which is done. And the fourth one is deterrent agent. Okay, alcohol sensitizing drug. So disulfiram, earlier this was very very commonly given for all patients with alcohol dependence. Everybody used to get disulfiram, um, tetraethyl thiuram disulfide. Now it is not used so much. So this is a sensitizing drug. What happens if a person consumes alcohol and when he's taking this medication, he can have severe reaction. Why? Because when you consume alcohol with this ethanol, ethanol gets converted into acetaldehyde, acetaldehyde to acetate. Acetate has to when it's metabolized, and then it is converted into carbon dioxide, water, and is excreted from the body. Disulfiram prevents the conversion of acetaldehyde to acetate. So acetaldehyde accumulates in the body and it can have severe reaction. Okay, very uncomfortable, palpitation, sweating, discomfort, person feels he's going to die. So we give a alcohol challenge test a person when he's on this medicine, slight amount of alcohol we give and make him aware as what could be the consequence. So before starting disulfiram, a renal test, thyroid function test, pregnancy is ruled out, psychiatric condition is ruled out. When everything is okay, the person consent is taken and he's given an ID card telling that, warranty card telling warning card that he's consuming, he's taking this disulfiram, so that in any emergency the physician knows the precautions to be taken. And they are given very clear instruction that patients, when they are on disulfiram, they're not supposed to take alcohol in any form. Not only consuming alcohol, aftershave lotion, anything which has vinegar, your pickles, chocolates which has alcohol in them, any form of alcohol they should avoid, or else they could have this reaction. And this medicine is given as disulfiram 250 mg in the night, and it is increased to 500 mg in the night. And when they are under the they take this tablet, they're not supposed to do heavy work, driving. All this has to be avoided. There are other deterrent agents, okay, but very common now what they use is anti-craving agent. Acamproside, you must have come across in your hospitals. Patients must be getting acamproside, which is a anti-craving agent, and also naloxone, naltrexone, and fluoxetine, which is a SSRI. This is also used as a anti-craving agent. And other medications also, like if the patient is having anxiety, anti-anxiety agent, depression, antidepressants are given, and psychotic condition. So the other medications are also given based on the condition, the underlying psychopathology the person is having. The last one is your medical management, is your psychosocial rehabilitation. Rehabilitation is very important. Patient has to, the medical social workers work with these patients, give them a job, frequent follow-up, attending group meetings, because it is a long-term illness and the relapse is very, very common. So psychosocial rehabilitation is very important when it comes to alcohol dependent syndrome. Okay, with this we come to a conclusion of alcohol dependent syndrome, the part of the disease condition. The next clip will be talking about the nursing process, nursing management of a patient with alcohol dependent syndrome. Thank you.